Let's today listen to one of the most important topics that we all want to learn on, and a topic which is most imperative, important in today's context, when we all have moved almost to digital, trying to do digital things, trying to explore more areas related to digital. 4 Ps of digital health. And we have one of the most distinguished guests today for you, Mr. Salil Kalyanpur. Well, this session is under 𝐃𝐢𝐠𝐤𝐿, Continued Pharmaceutical Education. This is the third session under 𝐃𝐢𝐠𝐤𝐿 that we are hosting today. And this is with collaboration from 𝐏𝐚𝐫𝐭 Manipal Academy of Higher Education. We thank 𝐏𝐚 for joining us in these sessions. Let me introduce in a few moments. The name doesn't need any introduction, Mr. Salil S. Kalyanpur, but let me read out a few lines. He is having 27 years of commercial leadership experience across India, emerging markets, and Europe. Until August 2017, he was an executive member of the Global Established Products Leadership Team at GSK and member of the Board of Directors for GSK Asia Private Limited. From September 2017, he is in marketing, strategy, and digital business transformation. He's an advisor and mentor to companies, leveraging his extensive experience in the pharmaceutical industry in companies like Dr. Reddy's, Pfizer, and GSK. He is a valued speaker and industry thought leader in pharma industry, sector expert on business TV channels, and visiting faculty at NMIMS top 10 business school in India. He is an interested health policy observer, and that is very interesting about him. And we would love to hear what he has to share today with us. So this is it from my side. Over to you, Salil sir. Guide us today related to digital health.
So to talk about the 4 Ps of digital health, I think a good place to start will be where you talk about what digital health, or define what digital health actually means. And I think digital health is a very misunderstood term. Sometimes people think about health and say that technology doesn't have a role to play, or sometimes we think about technology and we say that it's all about technology and nothing about health. So digital health essentially is about the use of technology to address health needs, and health needs are not of the doctor, not of the pharmaceutical company, but of the patient. And so therefore, everything about digital health is essentially about being patient-centric, or it's about being people-centric. Because why I say people-centric is because this is a lot to do with preventive, as well as to treat people who do not, or who have an absence of disease. So health is not actually talked about or defined as an absence of illness, but it is defined as a presence of wellness. And I think digital health has a huge role to play over there. It's a largely untapped market as far as our industry is concerned. And so therefore, a completely new, different set of companies have come into this space. And they are using digital enabled technology to reach out to people who are well, to people who are ill, and helping them to either prevent disease or to manage their existing disease. And this involves a lot of different tools like digital therapeutics, like mobile health, like wearable sensors, devices, personalized healthcare, telehealth, etc. So a lot of different arms exist in digital health, and this has kind of created many more opportunities for healthcare providers and healthcare consumers to manage their illness or to stay healthy, as the case may be. Digital health is a thing that has actually started to come up in an environment that is rapidly changing. Until March 2020, digital health had a very strong presence, and it was considered as an industry that was mushrooming on the side of the conventional healthcare industry, which is hospitals, pharmaceutical industries, pharmacies, insurance companies, etc. Post 2020, the influx of technology, the use of these platforms, the creation of these companies has merged very well within healthcare. And I think the environment has changed in a way which affected consumer behavior. And I think that is the more important thing, because consumers accepted a large number of different interventions which did not exist before Corona or the pandemic happened. And so some of the trends that are actually shaping healthcare in the new normal is that, we saw a lot of government reform. Okay, government reforms. The greatest example of that government reform is where real world evidence started to be used instead of looking at long drawn clinical trials. And so therefore the result of that was that vaccines, which generally took about 10 years to come, came to the market in 10 months, which was a record, right? And of course, the reform that was used there was to use a clause called the emergency use authorization, which was used in pandemics and in cases of national disaster. And that reform really allowed a completely different set of products, of services, of companies, etc., which came into the market. And that allowed, next generation managed care, a different generation of companies that used managed care. It accelerated. And that acceleration happened because of the use of, or because of a few changes in consumer preferences, which allowed the adoption of large-scale technology-based platforms. And the idea there was to look for health for all. The goal that everyone was playing for was essentially the goal for health for all. Okay. And the world moved from being, or the world moved from understanding healthcare as a very fragmented delivery system where insurance companies existed separately, doctors existed separately, hospitals separately, pharma separately, etc., to all come onto a digital platform and create what is called as an ecosystem. An ecosystem of services, an ecosystem of products, an ecosystem of companies providing those services and products. And at the other side were the consumers. And consumers were largely driven by the number of companies that were on platforms that are getting created. So you can think about all the different consolidation that you're seeing in the market, which is the formation of the Reliance platform, the formation of the Tata super app, the Tata platform. Then there is Pharmeasy, which is trying to do something on the side. Very recently, Dr. Reddy's, Lupin, Apollo Hospital, all of these companies announced that they're working on a super app. They're working on an integrated way in which healthcare is delivered to consumers. Okay, so that was one very, very important trend that was shaping healthcare. That is shaping healthcare in the new normal. Now, why did this happen? This really happened because people, consumers, they started to become very fearful of or they brought in a renewed focus on health and well-being. And the whole idea about focusing on health and well-being had moved on from simply thinking about my healthcare, okay, simply thinking about my healthcare, to also worrying about the health of others. Why were they worried about the health of others? It wasn't because suddenly people became more compassionate or because people became more community oriented or the goodness of people didn't come out or it didn't change. It was largely because others were considered as a source of the illness. Okay, they were transmitters, they were carriers, and so on and so forth. So people required people around them to be healthy. And when people around them are healthy, they realized that it was important for them to be in the company of people who did not have a risk of carrying the virus, who did not have a risk of carrying the illness, and so on and so forth, which was not something that you saw in the past. Okay, and not only were people thinking about others, but they were thinking about themselves. One of the changes that happened in the new normal is that people were equally invested in keeping other people happy or other people healthy, as a consequence of their own health, right? So if other people around them were healthy, they would stay healthy, and so therefore they started to think a little bit about not just themselves but also about other people. And I thought that is a very, very important trend in consumer preferences, or a change in consumer preferences which didn't exist. So the environment has changed, the consumer has changed. Okay, and what we need to know is that the consumer has actually started to think about there is a certain permanence that has come into these consumer preferences. So two industries that are really affected or are considered to be the industries of the future, or where consumer preferences are not likely to come back to the previous normal or pre-COVID era, Are e-groceries, or the way that you buy groceries, where most of us have moved on from our neighborhood grocery stores to Big Basket or Grofers or Amazon Pantry or whatever else, one of those areas where you buy them online. The other one is virtual healthcare. Now, virtual healthcare has essentially given people a very strong understanding of how to manage their health in the comfort of their own homes. Now, this isn't something that didn't exist before. It existed before, but people really didn't give it too much of an importance. And the reason for that was that there was an option of seeing the doctor in person. There was an option of going to the clinic and feeling the stethoscope or the doctor's comforting hands on your palms or on your wrist, feeling the pulse. He would palpate you, and you felt that it was a very important part of consumer psychology, that unless the doctor actually touched me or felt me or palpated or examined me, I wouldn't really want or I wouldn't feel that I have been examined well enough. Okay, but today we are quite comfortable with the fact that physical touch and feel is not required. Okay, and so therefore the whole concept of time and distance has been rendered unnecessary. Okay, there is no particular time in which you can find a doctor. Okay, you can use a teleconsultation service at any time of the night or day. There is no guarantee that you will find the same doctor, but you will have somebody who will be able to give you medicine. Okay, so the not only has the medium dematerialized these services. Earlier we used to have physical hospitals, physical clinics, all these things, but now that has become dematerialized, right? You have a diagnostic laboratory kind of strapped around your wrist, where you can look at your oxygen, you can look at your glucose, you can look at your heart rate, you can understand many different vitals. Okay, then there is a mobile phone on which you have 2 or 3 different apps which can help you to order a medicine, can order a diagnostic test, and you can order a doctor consult or any of that, and it essentially becomes available to you very easily. Now, this kind of a comfort is unlikely to go back. So this is McKinsey Global Institute analysis, which has found these 2 industries, of course, with home nesting and others, but that's not really our concern. These are 2 industries where we feel that, or where McKinsey feels that there is a high stickiness to this comfort, and a lot of this virtual healthcare is going to be permanent. It's not going to be going away very soon, as along with the virus. So why is this stickiness there? Why is this that people have accepted that healthcare can be virtual? Because the whole consumption pattern of healthcare has essentially changed. Okay, and the consumption of healthcare having changed essentially means that people have understood that accessibility, affordability, and quality doesn't have to be in a particular space. It doesn't have to be in a particular hospital, or you would talk about a particular hospital being cheaper than another hospital, or you would go to a government hospital instead of a private hospital or something like that. But now what you've realized is that there is an institutionalization of those services. Standards have been institutionalized, or those kind of things that patients expect have been standardized across different platforms. So you have self-health management enablers, you have affordable medical devices, you have EHR and analytics, which give you access to your own data. Then you have telemedicine, you have point of care diagnostics, you have patient education and awareness. So almost everything that we required to keep ourselves healthy or to manage our disease is now available via the mobile phone or via the internet. And that is a major shift that has happened in the consumption. And technology has changed quite a few things in this, in the whole way that healthcare is consumed. Okay, and not just in healthcare, but technology has changed life as we know it. So when Neil Armstrong went to the moon, he basically took 5 photos. Okay, and this lady on the right side went to the bathroom and she took 37 photos, right? So today we are taking selfies. We are like, for us, publishing, printing, making videos, making reels, making content and loading it on our social media platforms and our accounts and talking to our network and all that is very normal. Okay, people have, I mean, youngsters, the younger you are, the more comfortable you are doing this. Okay, of course, Mr. Vivek Khatangadi is a big exception to that rule. But other than that, I think, people who have been born around 2000 or the millennials as they are called, are in the late 90s and in the 2000s, are extremely comfortable with the way that technology has changed. Now, the COVID pandemic gave us enough time for other people, other generations also to catch up. Okay, and many of us have now started to understand that the mobile phone is a source of great amount of connection with the outside world. You don't literally need to be physically present there. You can connect and you can be in touch with a lot of different service providers or friends or anything like that through your mobile phone, as long as you have internet or a data plan. Okay, and so as technology entered into different aspects of our life, obviously healthcare couldn't have been left behind. Okay, and technology has become a very, very integral part of healthcare today. And because of this, because of the big tech invasion of healthcare, okay, a lot of things have actually changed. And one of the biggest changes that has happened over the last 1.5 years is that people have understood the concept of do it yourself or DIY healthcare. Okay, doing it ourselves is essentially where people know that their healthcare does not depend upon the doctor. It doesn't depend upon the hospital, or it doesn't depend upon a diagnostic lab. It basically depends upon themselves. What they do will decide whether the disease will progress or it won't progress. And most people who have had non-communicable diseases or NCDs or chronic illnesses have really kept themselves very, very healthy. They've taken very good care of themselves, managed to keep their blood pressure under control, managed to keep sugar under control, managed to keep many of their other illnesses under control, so that they don't have to go out and risk getting an infection from hospitals, right? Because we all know that the 100% sure shot place to go where you can get a coronavirus infection is a hospital, because that the hospital is teeming with those people, right? Teeming with people who have these kind of problems, okay, and who have these illnesses or these infections. So if you wanted to go to, if you wanted a corona infection, the best place to get it would be a hospital. And so therefore people avoided going to hospitals. Earlier they thought there was no choice. Now they realize that choices are all on their mobile phones. And so technology has basically driven an era of do-it-yourself healthcare. Now, what happens with all that technology, or what happens with all of that data, is essentially something like this, right? So I don't know if any of you can tell me what this is. Okay, it looks like a factory, which is, it's got very neat, clean storage rooms and so on and so forth. These are basically what are called as big data farms. Okay, the pictures that I'm showing you belong to Google, where, so whenever you say something like, where is the data being stored, it's on the cloud. Everybody shows the cloud like this, right? On the cloud. The cloud is not here. The cloud is right on the ground, right? This is where all the data is being stored. Now, these big data farms are where every single transaction of ours on our mobile phone or on our laptops or on any other system gets captured. All these data points get captured over here. They are looked at with a great deal of interest. They are analyzed. They bring out business insights. They do a lot of different things, right? And for these big data farms, which are analyzing the whole life of a person, managing the healthcare is a small part of it, which is an integral part of it, right? So data farms are another very, very major reason where all your data is getting stored, all your health information is getting stored. It is being stored securely. There is security. There is an allowance of portability. There are a lot of different things that are happening over there, which essentially give people an opportunity to use that healthcare data to make their health better, or to prevent illnesses, okay, whatever is that. So that's why they say that data is the new oil, right? All of us have heard this cliche that data is the new oil. Very few of us actually understand what this means, right? In the sense that what happens with all this data, okay? Now, the other question is, where is all this data coming from, which is making it big, okay? And that's everything that is there on your mobile phone is allowing that data to stream into these data farms and creating a lot of things. Now, for healthcare, now this is about social media. This is a lot of different things, your work, your business, your pleasure, your fun, your games, everything else is getting captured over here. Specific to healthcare also, we are able to understand that, the world is becoming interconnected. The world has become interconnected. It has become much, much more interconnected now, post March 2020. and so many different, wearable trackers, platforms, applications, the use of technology in almost every aspect of healthcare is what is actually defining healthcare as digital health. So therefore, with this context, with this whole context of whatever is happening in digital health, I think we need to be able to debate whether the 4 Ps of digital health are the same, or have the 4 Ps become different, or have the 4 Ps changed. So, obviously the 4 Ps have become changed. The first P of digital health is that a data glut. All that data that is coming from all the apps on your phone and all the activity that you're doing on internet is making healthcare predictive. When you have a lot of data available and you have those big data farms that we just showed you about Google, all of that makes your healthcare predictive. Okay, why does it become predictive? Because the patterns of your lifestyle, the patterns of your eating habits, the patterns of everything else that you do, your sleep deficit, your the number of kilometers that you walk in a day, the calories that you burn versus the calories that you consume, the medicines, whether you're taking your medicines on time or not, and so on and so forth. There are lots of such determinants which actually can predict your health. Okay, and these advances in technology and these predictive tools are extremely important in helping people to understand whether they are on the right track to stay healthy, or if there is a change in the lifestyle that is required, or whether people who are already suffering from the disease, whether that disease will make it worse, their lifestyle will make it worse, or it will become better. And so most of these things, the two most disruptive factors in recent times are the rise of the internet and the smartphone. Okay, and that is allowing a lot of health apps or a lot of different technology based tools which allow you to capture your health data, create analytics, and through that analytics your health then becomes predictive. Okay, so there is an accuracy of diagnosis and treatment in personalized medicine, and so therefore it also leads to a lot of insights and a lot of information to you about what you're doing is, whether what you're doing is right or what you're doing is wrong, and the impact that it can have on your health. The second P is personalized. Okay, because the data on your phone is only yours. The reports that come out of the data on your phone will be yours alone, right? It's not that you will get an aggregated report, or you won't get anything which is very different. Now, along with the need for technology or with the infusion of technology within healthcare, it is leading to a lot of services or a lot of achievements, like the whole human genome is actually now available. Okay, it has been mapped. The whole human genome is mapped. The viral genome got mapped. Okay, so there is this very interesting statement that an American scientist said. He said that the digital virus reached the American shores before the biological virus did. And what he meant by that was that scientists in China had actually mapped the viral genome in November or December of last year. Okay, November or December of 2020. And during that time, November or December of 2019, even before the pandemic was declared, and it was put out on the scientific commons, and scientists in the United States and around the world had access to that viral genome. And that is how companies like Moderna and BioNTech and some of the other initial guys, the initial vaccine providers, were able to develop the vaccine very, very fast. So even before the first viral case was registered in the United States, the vaccine was ready. Now, obviously, the vaccine couldn't have been used directly because it required a little bit of study. And so therefore, it took another 10 months for that vaccine to be commercially used. But the fact is that high-tech technology, high-tech tools, high-tech data computing power, and high-tech cloud storage is creating an ability for us to store a lot of data, to understand and analyze a lot of data. And so therefore, once your genome gets mapped, which is like petabytes and petabytes of data, if it is getting mapped, you get a report. Okay, and a report which is like a one sheet of paper, which actually tells you what kind of diseases you have predisposition to, what kind of diseases you can get, what is your genetic mapping in the nature. Are you strong in certain areas, in the sense that you will never get hypertension, or you will never have cardiovascular problems, or you'll never have diabetes, or you will probably be, able to develop some sorts of cancers at a certain point of time, or you have a predisposition for rheumatoid arthritis or anything else, right? Or you may have skin problems, or you may have breathing problems or something like that. Now, when you get a report like that, you know exactly what you can do with that data. You know exactly the kind of interventions that are required to avoid those illnesses. Okay, and there is a company which makes what is called as a genome patri. Now, a genome patri is essentially like your kundali, right? You get a kundali of an infant as soon as the infant is born, or within the first year or something like that, just to make sure that everything is fine, and you get a priest or the head of a religious institution to kind of acknowledge and give you a sense of what the future of the child may be. But very few people actually think that a genome, which has got a much more indication, or a much more higher probability of coming true than the stars and so on and so forth, those kind of things are actually not known. And one of the reasons for this was that this technology was quite expensive. Now, because of COVID, because of the fact that genome surveillance is required, because of the fact that more genomic mapping is happening, infrastructure is getting built. More and more laboratories which do these kind of testings are coming up in the private sector, also in the public sector. Now, with that sort of technology, with that sort of proliferation of infrastructure, what you can expect is that the cost of these tests will fall drastically. And when that happens, more and more people will essentially have access to a personalized health plan within the first 12 months of their birth, of their life. You can get it done for your children. You can get it done for somebody who is like, very, very young and has a very clear view of the next 50, 60 years or 70 years that the person is going to live, which is, and gives extremely strong understanding of the kind of diseases that the person may have, or something that may, happen to that person. And so therefore, preventive or you can take some action to not allow that to happen. Now, the third P, therefore, is making healthcare participative. When you have a personalized health plan, which is extremely predictive in nature, okay? It is, so just to remember, predictive, personalized, and participative. So when you have predictive health plan, which is available at, at a very personalized level, you are able to participate in your healthcare. You can make your choice, okay? And participative medicine, actually, it rose as a trend to counter physician paternalism. Now, what this means, what physician paternalism basically means, is that physicians used to always tell you what to do, and you had no other option but to quietly listen. Okay, despite the fact that you had many questions, or sometimes you didn't understand the diagnosis, or you sometimes didn't trust what the doctor was telling you, you had no option. The best that you could do in India was go to another doctor. But in certain other cases, you probably, in certain other countries like in Europe or in America, doctor shopping is not very easy because you're governed by many other rules, right? And so therefore, it becomes very, very difficult for people to understand why they are doing certain things. And many times, because of a lack of understanding, it's possible that those people will not comply, that patients will not comply to therapy. And one of the reasons one of the biggest challenges in pharma is a lack of adherence to therapy, a lack of compliance to a doctor's prescription, which does not allow health outcomes to get better. But today, when you have patient-centered approaches, or you have a patient as a partner approach, where the patient is an equal participant in his own healthcare decisions, or a patient, not even a patient, a person who does not even have a particular illness or a disease, understands what is likely to happen to him because he has a genome patri, or he understands that he is predisposed to certain conditions or something of that sort, can actually take preventive measures, right? Can participate in his own healthcare, make the decisions that he wants. He can decide what kind of diet he wants to have. He can decide what kind of exercise regimen he needs. He can decide when he wants to do it. All of this, the participation part becomes extremely interesting for people to do. And once participation becomes an important part, the last and the fourth P essentially is that healthcare will become preventive. And what we are seeing nowadays is that because of this, the trend of technology coming in, the kind of tools and access to information that digital health companies are providing to us, we are able to understand that, we are able to see a trend where youngsters or people have now started to look at their fitness in a much more definitive manner. Okay, so that's why you're seeing nutraceuticals becoming a huge sector in the industry. You're looking at cosmeceuticals becoming a very big part of the industry. You're seeing food and dietary supplements becoming a very important component of the pharmaceutical industry, and so on and so forth, right? So there are many different things that are possible when people understand that they have to prevent an illness. And the prevention part of the industry is becoming much larger than the treatment part of the industry, or it is actually getting a lot more focus. That is where a lot of private capital is flowing. That is where venture capitalists are investing their money, because they understand the scope of prevention. Okay, so these are the kind of 4 Ps, and in summary, what I would like to talk about is that the 4 Ps of digital health are essentially are predictive, where healthcare becomes predictive because of a lot of data. It becomes personalized because you have technologies like gene therapy, and the cost of mapping all those technologies has gone down drastically. You also become, all of this information makes you more participative in your own health plans. And when you have that level of participation, you also understand that preventing disease has become much more easy than it was in the past. Okay, many of us didn't know that smoking was bad, or at least about 100 years ago, doctors used to promote smoking because they didn't know that it used to cause lung cancer. But today, because of a lot of information which is now available, the democratization of information which has happened through technology is actually giving us insight into many of these different things. We can keep in touch with the emerging trends in medicine and emerging trends in science as quickly as any other professional in that field. And that allows us, through a whole host of different technology tools, to make our life much more healthy. Okay, 10 years ago, this was not possible. 10 years ago, healthcare would have, this kind of a situation would have been considered as highly speculative. And people would have said that you're talking about something which is very futuristic, or it sounds like science fiction. But no longer true. Today, the 4 Ps are, very widely accepted. And that's the whole reason why, the COVID has actually accelerated this change. This change wouldn't have happened if we had not experienced a lockdown. This change probably would have taken longer to happen if doctors were available freely for us to go and consult. Maybe our thinking would have not happened about, making time and distance irrelevant, and we would have still wanted to see the doctor physically at a particular time rather than talking to him or her over an app. We would have probably not trusted an app to give us health advice, and we would have probably not trusted an artificial intelligence tool in that app, which kind of makes our health plan personalized. Okay, all these things have changed now because of the acceleration that COVID created, right? And what has happened is that this has resulted in digital changing healthcare as we understand it. Okay, I'm not saying that everything is changing. I'm not saying that nothing of the past exists. What I'm saying is a large part of healthcare has now become, or change is affecting a large part of the healthcare industry as we understand it. I think, therefore, the takeaway for us is that pharma has to become more people-centric. We call ourselves patient-centric, which implies really that, we are talking only about illness. Okay, while illness is a very important part, wellness has emerged as a huge industry absolutely on the side. Okay, and so therefore, I think for pharma to be able to get the best of both, okay, and not relegate itself to illness alone, I think we need to move away from being patient-centric to becoming people-centric.